Welcome back to the 2026 APAICS Health Summit. I'm Tanya Layden, Vice President of Development and External Affairs at APAICS. Our next panel is From Guam to Flushing, Mapping Health Disparities Across Our Communities. This panel will explore how remote location, elder care needs, chronic disease management, and limited healthcare infrastructure can create disparities for certain communities. I'm honored to introduce CAPAC's second vice chair, Congresswoman Jill Tokuda, who represents Hawaii's 2nd Congressional District. Congresswoman Tokuda is a ranking member on the Subcommittee on Conservation, Research, and Biotechnology on the House Committee on Agriculture. As a member of the Rural Health Caucus, she is a strong advocate for policies that aim to improve the delivery of healthcare and mental health services in rural areas. Please join me in welcoming Congresswoman Tokuda.
Aloha APAICS Ohana. So if you've ever wondered what's between Guam and Flushing, let's find out. Hawaii. Yes, Hawaii is between Flushing and Guam. And as you can imagine, I would have rather have been on a nice sunny beach, and that was the plan. But sadly, we have been extremely devastated by a series of kona lows here in Hawaii. You may have seen it on the news. And I bring this up because oftentimes, whether it's a global pandemic or natural disasters, our ANHPI community often has high disparities in terms of our ability to get health care that we need. Mortality rates are a lot higher, and a lot of it comes down to the fact that our healthcare system is not culturally sensitive to us. There is oftentimes a lot of historical trauma embedded in our communities that make us less trusting, whether it's of vaccines or going to the doctors. Language is often a barrier. There are so many reasons that oftentimes ANHPI communities are the ones that suffer the most when it absolutely could be 100% preventable, which is why forums like this, online and in person, wherever we may be, are so critically important because we can and must bridge that gap between healthcare and our Asian American, Native Hawaiian, Pacific Islander communities right now as we're going through this devastating aftermath of our storms. Healthcare, I promise you, is one of the big issues that I'm trying to tackle, from making sure that people aren't affected by mold growing in their homes that have been flooded out, making sure that the standing water that we see does not breed mosquitoes, have staph infections from people getting cuts as they clean out their homes. But most importantly, too, the scars and the injuries you can't see on the surface, that mental health component that's so important. Those are big things that I want to make sure we're taking care of for our community. Conversations you're having today is about making sure that our communities, no matter where they live, no matter what part of our beautiful diaspora, our NHPI community, as diverse as we are, scattered throughout this country, through the territories, making sure that we are seen, we are heard, we are taken care of. So a big mahalo to all of you for this conversation you're having. And please know that in Congress, CAPAC, we're your allies, 100% on every step of the way. So thank you again for these conversations. I look forward to seeing you in Hawaii, Flushing, and Guam, or wherever our feet may find ourselves.
Next, I'd like to introduce Congresswoman Amata Coleman Radewagen, representing American Samoa. Congresswoman Radewagen serves on the Subcommittee on Health within the House Veterans Affairs Committee, as well as the Subcommittee on Global Health, Global Human Rights, and International Organizations within the House Foreign Affairs Committee. Please join me in welcoming Congresswoman Radewagen.
Talofa lava. I'm happy to be able to greet your event and thank you for the work of your excellent organization. I especially welcome your focus on the healthcare needs that are so important in American Samoa and so many jurisdictions around the country. I represent American Samoa, where our hospital, the LBJ Tropical Medical Center, was at one time a historic signal of U.S. commitment in the South Pacific and the Pacific Islands. It opened its doors back in 1968, a long time ago in terms of healthcare changes and technology. Some truly wonderful people work there, but it's no longer a modern facility. Ideally, we'd build a whole new hospital fully supplied with the latest technology. As you can imagine, the ability to do that on an island with a population of a little more than 50,000 people is limited by the local tax base and the sheer extra cost of everything that must be shipped in. Another challenge is lower reimbursement rates compared to Medicare that make it more difficult to attract providers, a national issue that really makes itself felt in the territories. Those are the headwinds we face in American Samoa. Other places have their own challenges. The relatable part is the need to deliver quality health care in remote, low-populated, or economically challenged places. Telehealth is a key, but by itself cannot replace the need for a modern hospital, though it can stand in some gaps, making the best expertise available. The reality is telehealth cannot be separated out and viewed as a replacement for infrastructure and equipment. Those will always be needed, but it can reduce the burden. I've been listening to our frontline medical professionals for years, and my door is always open to hear from you. I'm happy to consider legislation that hasn't reached me in my 3 committees yet. Regarding legislation, I'm a co-sponsor of the Territories Health Equity Act, eliminating our Medicaid caps like the states. We also expect the House to soon pass our in-state tuition bill for island students, which would certainly benefit aspiring nurses and pre-med students from the territories. Thank you for bringing together expertise and putting in this effort to assure our Asian American and Pacific Islander American communities are heard and supported. I'm very optimistic as I meet so many fantastic Asian and Pacific Islander American young people that are brimming with leadership and ideas. Our future is bright, and this summit is helping do your part. Thank you. God bless your summit. Soifua Ma'iamanuia.
Our panel moderator, Samira Khan, is the president of the South Asian Public Health Association. Samira is also currently the Assistant Director of Research and Clinical Initiatives at Mount Sinai in New York and is a board member for the National Asian American Pacific Islander Mental Health Association. Please welcome Samira and our panelists.
Thank you for that introduction, and thank you to APAICS for convening this important conversation. I'm honored to moderate this panel alongside such thoughtful leaders working across policy, industry, and community engagement. Our panel today is From Guam to Flushing, Mapping Health Disparities Across Our Communities. The title reflects an important reality: where we live often shapes our health outcomes and access to care. As someone working in public health, I see every day how geography and community context can influence across to health and care infrastructure, providers, and services. For many Asian American, Native Hawaiian, and Pacific Islander communities, these challenges can be even more complex, shaped by factors like workforce shortages, barriers to research participation, and access to culturally appropriate care. Today, we'll hear from Jaspreet Chowdhary, Savine DaCosta, and Alice Lynn Fabiano and explore how these disparities show up across different communities and what solutions are emerging to ensure that they can all thrive regardless of where they live. So to get us started, could each of you briefly introduce yourselves, your organization, and how your work connects to improving health outcomes across diverse communities? We'll start with Savine and then go to Alice and then Jaspreet.
Thank you for the question. Hello, everyone. My name is Savine DaCosta, and I work in clinical trial access and representation at Biogen, with a focus on community engagement and ensuring historically underrepresented, underserved, and understudied communities are meaningfully included in research and innovation. My work centers on building authentic partnerships between healthcare systems, research teams, and community-based organizations to reduce barriers, language access, and lack of trust. I focus on embedding community voices early in research design, so access and representation are not afterthoughts, but foundational to how we approach equity. At the core of my work is the belief that communities are not hard to reach. They've been historically underreached, and that sustainable progress requires trust, transparency, and long-term engagement.
Thank you, Samira. And Good afternoon, good morning, good evening, everyone, and thank you for APAICS for gathering us together for this important conversation. My name is Alice Lynn Fabiano. I work at Johnson & Johnson, and I am our Global Head of Social Impact and Partnerships and our President of the Johnson & Johnson Foundation. And for us at Johnson & Johnson, for over 80 years, we've had a focus around our credo, which really is supporting our communities and patients, especially those most in need, and ensuring that there is both access and quality for those around the world. Particularly for my role, we look a lot around the crisis around caregiving and particularly around the health workforce. By 2030, we know that from the WHO, over 11 million healthcare workers are needed to close the gap for the healthcare workforce. And here in the United States, every year, over 200,000 nurses are needed to replenish the support and the capacity needed for our aging population and for a lot of the needs happening across our continent. In addition to the access and the number of health workers that could support patients, especially those underrepresented, we're also very focused on the quality of care. So, particularly around ensuring that culturally competent care, leadership and development and training for our frontline healthcare workers are in place so that we can ensure that everyone has access to good quality as well as care that they need in the way that they can most receive it. Really looking forward to the conversation today.
Thanks, everyone. I'm so excited to be here. My name is Jaspreet Chowdhary. I'm the Senior Legislative Counsel at Compassion & Choices. Compassion & Choices works to improve access and equity to end-of-life care and options. Our engagement efforts have built partnerships with a number of AANHPI organizations, including JACL, OCA National, Southeast Asian Freedom Network, and Impact, to name a few. Our team in Hilo, Hawaii has also helped us join the Pacific Islander communities, including a training in Samoa. Finally, our AANHPI Leadership Council ensures that the voices and experience of all communities, including AANHPI, are included in the end-of-life movement. In addition to partnerships with organizations, we invest in leadership councils and community-based participatory research, including Photo Voice. We also conduct capacity building trainings and work with local leaders to adapt materials so they reflect local values, language, and decision-making structures. We believe that education must be co-created and not imported.
Thank you all for those introductions. It's really inspiring to hear about the range of work that's happening across research, community, policy, and industry to address these issues. As mentioned earlier, geography and community context can shape across to healthcare in very different ways. So from your perspective, what are the biggest barriers communities face when it comes to accessing equitable healthcare? And how do factors like location, infrastructure, workforce shortages, or trust make these challenges even more complex for ANHPI communities? Alice, maybe we can start with you. So from the perspective of the care workforce and private sector partnerships, what challenges do you see in ensuring communities, especially those that are rural or underserved, have access to culturally competent care?
Thanks so much for the question. It's a really important one to tackle, and as everyone I'm sure knows and is familiar with around the United States, I mean, care is just unequal based on sometimes where you live, unfortunately. And so, rural healthcare, particularly, is something that we're looking into, and particularly thinking about how geography itself plays a role within inequity, as well as around how access to care plays out within there. For healthcare workforce, we know that there's gaps across the United States, but when you think about rural healthcare, it's some of the most under-resourced areas. And so those numbers around having a nurse, having a doctor, having a specialty care, and having access to those doctors and those nurses becomes even more of a difficult challenge for those who are really in rural populations. As we think about, in addition to that, whether it be language barriers, whether we think about transportation, whether we think about the right type of care at the right moment in time, they just get even more exacerbated. So we're very focused around thinking how we can look at this on a multidimensional perspective, and how do we partner? And that's where I would say, Samira, within the question around how the private sector can play in and how our approach is to it, we very much know that partnership is absolutely needed in order to solve some of these really difficult structural challenges. And so we work a lot with community-based partners. I very much agree with the other panelists, Savine and Jaspreet, around how we really need to find local partners who are really trusted within the community, who understand the communities the best, and are able to solve their solutions through the strength of the fabric of the community together, and really support that strength and support those solutions that are already out there, and just having them have a little bit more of an opportunity to scale and grow within their communities as well. So we're really excited to think about how we can use things like technology as a place for us to be able to think about how we can close some of that gaps between community care. We're really excited to partner with local communities as well as community leaders. As we know, every single solution is going to look very different based on the local context of where we are. And so we want to be very careful not to have a one-size-fits-all approach, or something that's dropping out from whether it be a white paper or something that's happening in one location without understanding how that can be adapted, or if it can be adapted to those who really need it within those various locations.
And Jaspreet, I'm curious how that shows up, in the context of end-of-life care and the communities that you work with. What barriers do ANHPI communities face when navigating these conversations and accessing the services?
Thank you. I'm happy to speak on that. So I'll say that in the end of life context, each of our communities has traditions and customs that may not be known or understood in a system with providers and resources that are not familiar with or from these communities. There's also challenges with limited culturally and linguistically appropriate material, historical trauma and mistrust of healthcare system, immigration concerns and fear of interacting with systems, lack of disaggregated data for AANHPI and Pacific Islander communities, which makes inequities at the end of life invisible. Finally, family-centered decision-making that may conflict with individual documentation-based systems. As I said before, there are traditions and customs at the end of life, and in many of our communities, we operate within a family collective decision-making structure. While many healthcare systems, almost all actually, are based around individual autonomy and documentation. So this mismatch creates tension and sometimes silence, and results in folks not accessing or not engaging with end-of-life tools and options.
Right. So Jaspreet highlights how cultural context can shape how families navigate care decisions. Savine, turning to the research side of this conversation, your work focuses on clinical trial access and participation. So how do geography and trust influence whether communities are represented in research?
Thank you for the question, Samira. They impact it immensely. They wind up being huge barriers because if you think about it, if a community doesn't trust, it's not going to activate. If it doesn't believe in the healthcare system, it's not going to go for care. So when we look at clinical research, that mistrust transcends healthcare as well as research. A lot of times people don't distinguish between the two. And what we have to do is we have to educate. We have to listen in the community first and foremost to understand what the needs, wants, and desires of the communities are. And then we have to educate and empower them to make certain decisions around their healthcare. And our hope is that part of that healthcare are clinical trials, and not just clinical trials being thought of as desperate and dying situation where it's our last ditch effort to get care, but in the upfront as part of the treatment options that people have. So as we address trust through education and through listening and to being in community, not in a transactional way, but in a sustainable way, and understanding what their wants, needs, and desires are, then we look to geography. If you look on a global scale, geography becomes an issue as well for some regional areas. And then when you bring it into the US, Our zip code should never determine the type of healthcare that we receive, but it absolutely does. And whether you're in the city or whether you're out in the suburbs or further out in the country where we have deserts for healthcare, it becomes more so important that we find ways to provide care for people in all communities, as well as the Asian American, the Native Hawaiian, and the Pacific Islander communities. These communities are specifically impacted by aggregated data, where we can't delineate down to each individual group. And if you think about these communities, they speak over 100 languages, so translation becomes a problem. So some of the areas that research is looking at are, can we do remote studies? Can we do what's called decentralized studies? And depending on the therapeutic area in the study, the reality is, yes, these things are happening. But at the core of it, do our communities know about these things? Are they aware? Do they understand their own health conditions? And we have to address some of those things, as well as looking at the geographies and how we can bring things to the communities or partner with people in the communities in order to have healthier communities that we work with. At the end of the day, we need to work with communities and not dictate to them about what we're going to do.
Thank you all for sharing those perspectives. It's clear that these challenges are complex and interconnected, but there are also many efforts underway to address them. So I'd like to shift our focus towards solutions. When we think about solutions, what are the strategies that are actually working to close these gaps, whether it's through community engagement, workforce development, policy change, or industry partnerships? What gives you hope about the direction that we're moving in? Jaspreet, maybe we can start with you, and then we'll hear from Savine and then Alice.
I feel hopeful because there's been an increase and excitement around community-based participatory research, which allows trusted community members and community members themselves to share their own story and talk about what solutions would be helpful to the concerns that they've raised. I think it's also exciting to train trusted community members on what resources are available for end of life care and end of life care decision making, and then have those community members lead conversations. Because evidence shows that when education comes from culturally aligned messengers, engagement increases significantly. I've mentioned before, but I'll say it again. In American Samoa and other communities, we have invested in capacity building so that education is delivered by local leaders who understand language, faith, and family roles. And I think another possible solution is expectations about what's wanted at the end of life and what to do with services. And then finally, not waiting until conditions are perfect to act or engage. Of course, we all want a system where everybody understands our cultural background, our religion, our traditions at the end of life. And that is not always possible. And so if you're waiting for conditions to be perfect to act, then that unintentionally increases disparity and inequity. It's important to engage where things are and with what you have. And sometimes that results in individuals having multiple roles, not only advocating for yourself, but setting the groundwork to do the education and increase access to culturally appropriate care for folks who come after you.
Jaspreet, I love what you said and where you went with that conversation. From a research perspective, we try and encompass everything that you have mentioned already. And when you add to that, we really try and partner with the trusted community base because, like you stated, that trusted voice delivering the message just elevates it so much more. In addition to that, using plain language and culturally relevant materials becomes imperative in research. Also, compensating community partners for their expertise. There's this myth, I'll call it a myth out there in most cases, that, clinical research is so far apart from what everybody else is doing, but it really isn't. Once it's embedded into the community, things like transportation, things like childcare, things like elder care are actually incorporated in a lot of the trials that we do. And we just need to inform the communities that this is what we have. And if it's not there, I often tell people, ask for it. just ask for it, because you never know what can happen, what we can offer. We also look to establish formal advisory boards with the community so that they partner with us and they're not just being told this is what's being done to you or for you, but they have an active voice in the work that we're trying to do and put in communities. One of the other areas that we feel could be a solution is to ensure transparency with the trials and return of results. Often we hear that people participate in clinical trials and they never know what happened after the fact. So we're working really hard at Biogen, as well as an industry, to return the results to participants and their caregivers, because this is it's a journey, and sometimes it requires a caregiver or a care partner, as well as the participant, to be involved. One of the other things is using community navigators and having culturally responsive consent. So depending on the cultures that we're working in, informed consent can mean many things. So making sure we're really culturally appropriate in the languages that we use in our informed consents, and that it is sensitive to the cultures that we're working with. Bring research into the community setting. That one can be more of a long game sometimes, because when we engage with principal investigators and sites in the community, it depends on if they can do the trial or not. So sometimes we're strapped for the locations that we go to because they can't do the trial. So in essence, we have to work with some of these communities in order to build up their infrastructures so that they're more able to participate in some of the more labor-intensive or difficult trials that are available. I like to say engagement isn't an add-on, it's part of the infrastructure. And if we embed that and we plan for being in communities, then that's the more success that we will see.
Thanks. And maybe I'll tack on from the health workforce angle, from a solutions perspective. I'd love to offer some optimism and hope as well. I think both panelists talked about just how much strength and how much assets there really are within our communities. And I think, for first and foremost, if we focus on harnessing that strength and that collective community, we really can make some breakthroughs within the existing sort of resources that we have. And oftentimes where I turn to are the people aspect and the strength of our people. And that's very much the view that Johnson & Johnson takes around strengthening the health workforce and the people who are really at those front lines. Maybe from a personal perspective, I come from a family of healthcare workers. I oftentimes think about one of my aunts, Katie, who worked well into, most recently retired, but she worked well into her 60s and 70s. And she really was somebody who I look up to as somebody who really took on the service around caring for those who couldn't care for themselves, and chose to work at public clinics where safety net populations were really a part of her day to day. And I think a lot about the long hours she put in. I think a lot about not just the clinical aspects, but really the compassionate and the emotional care that she really took into ensuring that patients really understood some of what was happening, sometimes very difficult situations, and then being able specifically to relate to them from a culturally competent perspective, whether it be in their language, speaking within their family, extended family members, and certainly Jaspreet, as you mentioned, and the life care and some of those rituals as well. So for me, I think the biggest solution we have are the people are our strength, and as much as we can really empower as well as champion and celebrate the healthcare workers on the front line, it will go a very long way for continuing to move our needle forward for health equity. And so I really do think strengthening the healthcare workforce, making sure that the population that we're serving has the representation at the health workforce level, that will definitely ensure some of the trust as well as the language and elements that we heard around data as well. The other piece I'd probably pack up, or maybe two other pieces that I get very excited about and continue want to advocate for. One is around the people. The second, I would say, is around the policy. I know we've got a policy audience here, and want to give a shout out to the Lorna Breen Foundation and some of the work that the organization's been doing to really protect healthcare workers and support the resilience and the burnout that we're seeing come up quite a bit. It's even more so within some of our underrepresented populations, and some of that data is coming out both anecdotally as well as quantitatively. So very much supporting and continuing to advocate for learner brain is really important for supporting the health workforce at large, for supporting our communities in rural as well as in urban areas. And then finally, if I can talk a bit about technology, I do think that there is a very important inflection point that's maybe upon us already related to digital health and artificial intelligence and how that can be used for good, for closing the gaps for care, for really thinking about rural, hard to reach populations, and maybe even helping us with data disaggregation, accelerating some of those insights, thinking about language as well as we look towards health equity for the future. It is super upon us, though, that the design of AI as well as the data in there is something where if we are not a part of it, it's not designed with and for communities, it will not serve the communities at hand. And certainly, as we think about healthcare workers and augmenting healthcare worker reach through technology, we really want to make sure healthcare workers have a voice within the design of those programs as well.
If I can add to what Alice was saying, just a couple of points. From from Biogen and from a pharmaceutical biotech perspective, I think one of the things that we can also be excited about is that we still have people that are committed to this work. We still have people that are committed to embedding the voices of these communities in the work that we do. That's one thing. And the other thing is, great point about technology. The one thing I would caveat is building that technology infrastructure in areas that are considered deserts as it pertains to technology, because some of our most underrepresented communities still have technology deserts in them. And so, in order for them to really take advantage of all of the advantages that we have with technology, it is upon all of us, even with policy, to put forth policies in which these communities can be empowered with technology as well. So I just wanted to add those two other points to what you were saying, Alice.
I think that's right. It's one of these pieces where I think the promise is always there, and there's always a lot of conversation around how technology is going to close the divide. And unfortunately, sometimes history shows that it actually widens the divide, at least in the short term. So I think, Savine, your points around ensuring that the investment, the conversation, the advocacy goes towards our health deserts and the lowest resource settings, not just our most well-resourced settings and populations, is a really important point.
100% agree with you on that one.
Yeah, thank you all. It's really encouraging to hear about the innovation that's and the work that's been happening across sectors. And I think, you both bring up such a good point, all three of you, with the access to technology in these different areas and hard to reach areas as well. Before we close, I'd love to ask each of you to leave us with one final thought. Many policymakers, advocates, and community leaders will be watching this conversation. What is one action you believe is most important to ensure that ANHPI communities are not left behind as we shape the future of healthcare? We can start with Savine, and then we'll go to Alice, and then Jaspreet.
Sure. I have more than one, though. I think we need to ensure that we continue to educate the communities about what's available to them in their healthcare and to build that pathway for people to really be empowered to participate in their healthcare and not just let things happen to them. The other thing is, as far as policy, continue to look at policies that are inclusive to all communities. This community specifically, because it's what we're talking about today, but policy is extremely important to the work that we do. And we need to be as inclusive as possible in those policies and making things available for people of all walks of life in all geographies, and just keep that top of mind.
Great. And feel free with Alice and Jaspreet to, add more if you have additional actions that you think are important. So Alice.
Yeah, maybe I'll just stick with the theme around healthcare workers and one, thank your healthcare worker, whether it be your neighbor, your family member, anyone that you see. I think certainly acknowledging the continuing effort that each of our healthcare workers does in service of our patients is always really important. And maybe I'll add an advocacy around encouraging and increasing the opportunities for those who wish to really go and get a degree within nursing and to enter the health workforce. We know that We have a population that will require more, not less care as we move forward. We know that's even more important within our underserved and our under-resourced communities. And so very much advocating for us to continue to ensure that the health workforce stays as a huge backbone for all the different pieces of care that we need, whether it be from birth to end of life.
I agree with everything my co-panelists have said. And I will just add that in addition to um, engaging and advocating for yourself, to not hesitate to put yourself in a position to be a leader in the future, whether it's in the policy arena, the healthcare arena, or other roles where you're impacting care and access to all community members. I also think sometimes in the policy space and healthcare space, they're sometimes seen as separate, but it's also important to, if you have expertise and knowledge or even a desire of what you would like something to look like, to engage in policy and engage in creating laws and regulations that make that possible. Earlier in the session, we were talking about technology and telehealth and telemedicine. There are a lot of regulations around how that is accessed and how it can or cannot be accessed, but there's a policy opportunity to engage in what we want and what we need. And finally, I think it's also important to normalize having hard conversations. End of life care and discussions are sometimes very tricky and hard and uncomfortable, especially in different cultural contexts. But it's important to take small openings and begin with a small step and starting to normalize those discussions, because what is talked about around family tables eventually and hopefully becomes what's discussed around lawmaking tables or around tables at organizations or companies that are making decisions about where to put resources and what those resources should look like. I said before, but I'll say it again, that waiting for perfection to act inadvertently results in exacerbating inequity at all stages of life, including end of life care. So it's important to do something now. And even if it's a small step, it's still a significant step.
Jaspreet, if I could just expand on what you said about the end of life, those are the same steps that happen at time of diagnosis. And being able to advocate and being able to basically work within the system, we have seen wonderful cases of people be able to get treatment that they would not have been able to get before. So your points are so well received, and just moving them further along in the continuum earlier on, and having that upon diagnosis, and then also end of life conversations all along the continuum of a patient's journey, a caregiver's journey, I think are critically important. I also just like to add, the future of healthcare is going to be shaped by data. It's going to be shaped by technology and by policy, all interwoven together. But at the base of that work is trust, and trust within the communities, trust as a foundation. And if trust is not built in the boardroom, it's built at the community level, one relationship at a time. It's the same in politics. Those trust factors are built one relationship at a time. And I think it's incredibly important for us to realize that with the people that we work with and the communities that we want to serve, that we continue to understand what their needs are, as I've said before, build lasting relationships with them in order to empower them to engage in policy, to engage in their healthcare, to engage in end-of-life care, and not see sickness as a bad word, but as something that they can bring to the table and discuss and do whatever they can to advocate around it.
And I'll piggyback off of the voice comments that both panelists are sharing, and I think it's a really important point around just every voice matters, every opportunity you have to really advocate, whether it be for yourself, for your family member, for your community. I think that would be one of the most important takeaway points as I'm hearing the themes across this conversation. I mean, maybe just to be a little bit more real with my own personal view around that. I'm part of the PI community. I don't think I certainly or we do enough of a job or as good of a job sometimes for advocating. We tend to be a population broad general strokes around putting your head down, doing the work, really being good about really just more the work than the actual voice piece of it. And it takes a while to find your voice and find in a way that's authentic to yourself and a way that represents you as well as your community and doing it in service of better health needs for all. And so I just want to recognize some of the elements there, as well as continue to encourage everyone to find their voice in whatever manner makes sense to you, in whatever way is meaningful. You heard a couple of different elements, whether it be around designing your technology, thinking about the data, going to the Hill, or talking a bit to Congress and policy. There's so many different ways to explore and find your voice and think about how to add it to others within the mix, that I just would continue to encourage us to do it in a way that is authentic and meaningful, but also will move the greater good together.
I think you all bring up such a good point about, not making sure that the community is also represented in these conversations. And, as we wrap things up, if there's anything else that specifically for community members and people who are, ANHPI, how they can continue to advocate for themselves and use some of the tools that all of you have developed to, reach out to their families and friends as well. If anyone has any closing thoughts on that.
It's exactly like you said, Samir. And I think Jaspreet said, when these become dinner time conversations, then we start to really have it incorporated into the family genre, basically, on how we can move forward. But I think one of the things that we can do is ask questions, ask lots of questions about everything, and then really monitor where you get those answers from, because there are trusted sources for healthcare, for policies, for technology that can be used, and that we need to engage in that. And one of the biggest things is really exercise your right to vote. That really starts at the base of a lot of the work that we're doing. Is you may not be the one that's going to stand up in the middle of a room and say something, but you still have the right to exercise your right to vote or to influence other people in your circle about what you found out. Share the information. Don't gatekeep it. Once you find something out, just share it with everyone you know. One of the things that I often say to people when they come to a community engagement event that I do is, I'm not going to ask anything of you today, except that if you've learned something, to please share it. And that's a difference for some of the communities, because they're usually waiting for the other shoe to drop, and say, oh, you want me to do this or you want me to do that. But I really just want them to engage in the information. And if they find something useful about it, then share it. Because I think education and empowerment are two of the biggest tools that we have in the communities that we work with.
I agree with Savine, and I would just add, if I may, we've talked a lot about community members and healthcare workers as separate, but as was mentioned, there are community members who are also healthcare workers. So I would also say that this advocacy and transformation continues in professional spaces. My training is as an attorney and a public health researcher, and getting inside those institutions and systems is daunting and intimidating, but there also is opportunity to shape how law is practiced, how public health is practiced, how medicine is practiced, how healthcare is administered. And as much as there's a work and role for community members, there's also community members within those systems that have a role in helping to shape how healthcare is delivered, how healthcare workers are educated, and what's prioritized. And I think that's another space where there's opportunity for advocacy, education, and transformation.
Yeah, and maybe I'll add. It's we're living through dynamic times, and I think healthcare as a whole is never for the faint of heart. And so I think it's fair to acknowledge that the optimism as well as the continuing to support and trust in the communities and our communities and the people at the heart of them, whether it be as patients or as healthcare workers or as clinicians or as advocates. You can have many different hats along the way. But I think that the view around continuing to keep faith, hold close the heart and the mission around bringing healthcare for all and driving that forward in small and big ways will be the most critical part as we think about navigating the waters ahead.
Agreed.
Thank you all for sharing your insights. Today's conversation highlights that, addressing health disparities requires collaboration across sectors, from policymakers, healthcare providers, researchers, industry leaders, as well as community, both community organizations and community members. And as we've heard from all of you, solutions must be community informed, culturally responsive, and designed with equity at the center so that no community, regardless of geography, is left behind. I want to thank our panelists, Savine, Alice, and Jaspreet, for sharing their expertise and the important work that they're doing to advance health equity. And thank you to APAICS for creating space for these critical conversations.
Thank you so much.
Thank you.
Thank you, guys.